just about coming online. This is our 25 Years to Safer Aging panel, and I will hand over to our chair, Andrea Nicholas-Jones, to introduce our panelists. Thank you.
Well, as you can see, Andrea is actually not quite here yet, but she's joining us now. Hello, Andrea.
Hi, sorry, I was flying around in the Zoom orbit somewhere.
Over to you.
Thank you very much. And apologies for the delay in my arrival, but I'm a complete technophobe. And I was floating around in the Zoom universe somewhere before joining you all. So thank you very much again to everybody who's attending today. And I hope you found the presentation from the Minister as inspiring and reassuring as I think I did. So the first session we have today is entitled 25 Years to Safer Aging. Now that might sound like a very long time scale, but I think we are all aware of the massive challenge and uphill battle that we are already facing in terms of getting the abuse of older people recognised and dealt with in the way that we as an organisation would wish to see. So we're calling for a safer ageing society by 2050. So that only gives us 25 years. Again, it sounds like a long time, but Hourglass has already been working for over 30 years to end the abuse, harm, exploitation and neglect of older people. And Hourglass has changed very substantially over that 30-year period. So I think what we're hoping to get out of today's session is that we'll be able to show you how far we've come and also set you out a clear route map of where we think we should be going in the future. This session involves key staff members from the organisation who will be talking to you about what their aspirations are and what their plans are for how we will move forward in the future. And hopefully this will set the tone for the conference, because we do really have to focus now on how urgent this has become. So without any further ado, I'm going to hand over for the first question to Richard. I've talked briefly in my rambling introduction about how Hourglass has changed over the last 30 years since its original inception as a campaigning organisation. What do you think has been the biggest shift in society, policy or the charity itself over those 30 years to become the Hourglass that we know today?
Well, I think we need to be really careful here not to do too much navel gazing, because this isn't just about Hourglass. This is about the sector as a whole and the issue and the voices of victim survivors here. But to get that short amount of navel gazing out of the way quickly, the organisation has changed dramatically because it's had to. So back in '94, when the organisation started, we were very much a campaign organisation, formed very much out of the support of Age Concern and their offices in London. And fast forward to 2025, and of course now we have casework team, a 24/7 helpline. We've managed to ensure that we have a voice across the 4 nations we speak in or we work in, and we need to ensure that voice is louder and louder for those older victim survivors. The problem we have is that whilst we as an organisation has had to change as this epidemic of abuse has increased 2, 3, 4 times over that period of time. And I say this a lot during meetings, but I've only been with the organisation since 2018. In 2018, we took about 4,000 calls. We're now in 2025, and with calls and our knowledge bank and our instant message service and emails and other touch points, we probably deal with about 75,000 now. And that is a remarkable figure, but it's also a worrying figure, because we know that's just the tip of the iceberg. We're just dealing with a very small, those people brave enough to come forward. So I think we've got to look at it from 2 ways. We've changed enormously. There's 30 members of staff across Scotland, Wales, Northern Ireland and England. We now have a casework service, 24/7 helpline. We're doing some training. We are working across all kinds of different sectors that we probably didn't seem possible in 1994. But the rest of society and general public hasn't come with us. We're still desperately trying to ensure that when we have these rare moments in the sun where people are watching what we're doing, that they understand that they're part of the solution. Because if more people listen to the voices of older victim survivors, then we'll find a solution. Now, the minister just said, fascinatingly, that she wants to support a safer ageing society. Now, that's the first time we've heard that, which is phenomenal news, and I thank her absolutely hugely. But we now need to get everybody who's listening on this conference, their friends, family, the sector as a whole, to join our Oath campaign, to start to look at what a safer ageing society looks like. And we as a charity will metamorphosize in whatever way is required to make those steps. Veronica, I know you probably got a different take on this as well.
Not so much a different take, but I suppose maybe just to add a little bit. Obviously, yes, Hourglass will continue to evolve. We have, over the past 30 years, obviously seen incremental change in law, policy and practice across the UK, but it's not enough, and the pace of change has been frustratingly slow. Obviously, I would say this, but I think the charity has been ahead of the game for a lot of time. We're fully aware of the epidemic of abuse of older people, but too often we're screaming into the abyss. Where I sit today in Northern Ireland, this is the only part of the UK that still does not have adult protection legislation. It's in progress, yes, but it's not there yet, and the resource to implement is very uncertain. And until we have that, we continue to rely on a regional policy, which various reviews have deemed as not fit for purpose. In the light of Dunmurry Manor and Muckamore Abbey, it should be a national scandal that weak policy continues to guide practice, exposing practitioners to unnecessary professional risk and uncertainty, and exposing older people, crucially, to further harm and abuse. And that's even before we turn our attention to the lack of implementation of the Mental Capacity Act to 2016, I think. Where is that? Where is the Office of the Public Guardian? We're seeing zero progress in some of these areas. Resources are limited, but we fund and prioritise what we value. There isn't enough money to go around, and governments across the UK and funders have to make difficult decisions, and I get that. But here's the thing. Abuse of older people costs the UK public purse £16 billion per year. And with the budget looming, I think today is the day we urge the Chancellor to consider this, because our research in the economics of abuse illustrates that the cost to help amend this epidemic of abuse is nowhere near what we're actually paying right now. Our figures suggest that in England and Wales alone, about 300 million against 16 billion needs to be spent annually to provide specialist services and remove the barriers. So yeah, to the Chancellor, our sector can help you save over 15.5 billion, and would be very happy to talk to you. So I think that's just some of my reflections really on where we've come from, where we are, and where we can go together.
Thank you. I think following on from that, Richard, I'm going to put you back into the spotlight again. So we've obviously made progress, but everything that you and Veronica is saying really indicates that the abuse of older people is still under-recognised, under-resourced, and under-prioritised, if that's a word. So what do we need to do to make it different? And the one question I would have loved to have asked the Minister, if I could have worked out how to use the chat function, is how much of an inhibitor is the fact that we're still talking about our domestic violence and abuse strategy having women in the title? How does that inhibit the work that we're trying to do with older people? Or does it?
I don't think it inhibits anything, because I think the vast majority of people in the sector are completely aware that violence against women and girls has become this catch-all statement I'm not saying it should be, but it has become that catch-all statement. We have lobbied tirelessly to change that. And we've also lobbied tirelessly for all specialist elements within the domestic abuse sector to be fairly recognised, for there to be parity across the board. And that's simply not the case. Now, I should point out that I also think that the abuse of older people has been unfairly put in that specialist category. I mean, Veronica mentioned, I think, a second ago that there are 2.6 million people affected by the abuse of older people, 2.7 million. That is not a specialist type of abuse. You know, we're not talking about a handful of cases per year. And we're often talked about in the same breath as extremely specialized forms of abuse. So that needs to change if we're really going to make a change, if we're going to really broaden the voices of older victim survivors and their families. So I think the short answer to the question is that we need to end the inherent ageism in society for the abuse of older people to really get the news, the narrative it deserves. And that, I hate to say it, is going to require a wholesale change in public thinking. You know, there was a very famous and savage death of a young woman that was across every headline in England and Wales, in the UK, a few years back. It was 8 pages, 9 pages later in the same newspaper that the death of an 80-year-old woman in similar circumstances was there. That is a microcosm of the issue here. No one victim is any more serious than the other, no matter what their background, their age, their gender, their colour. It really doesn't matter. What we've got to do is find a way of ensuring parity across the sector, that the ears are open to the debate, no matter, again, what age, sex, gender, colour, ethnicity that victim is. And until we get that, and until we end this ongoing issue around how we balance violence against women and girls, against violence against men and boys, against violence against older people, LGBTQ plus, etc., the debate is going to be circular.
So Veronica, putting you back in the hot spot again, having listened to that, what are the 3 non-negotiables we need to be looking at if we are going to achieve this ambition of having a safer ageing society by 2050?
Okay, it's going to be really difficult for me to do this in 3, but I will try to be succinct. Look, safer ageing in its entirety is about prevention. It's about forward planning. It's about awareness raising and education. So I think prevention as the foundation is absolutely crucial. Safer ageing, and you know, I was delighted to hear the minister's comments earlier and clearly commit to the ambition of a safer ageing society. So safer ageing, in my view, has to be built into every policy, every service, and every community structure, not treated as an afterthought, proactive and priority. Point 2, empowering older people. And I think that's crucial. So that goes a little bit beyond protection. Safer ageing means older people taking an active role, being fully informed, supported and valued in decisions about their lives, their risk, their care and their communities. And I think we need to empower older people. We have seen a huge increase over recent years in older victim survivors making contact with the charity. A few years ago, older victim survivors were about 20% of the people who phoned us, and now that figure is well over 50. That empowerment is happening. We need to see it happening more. Richard touched on parity in response and dealing with the issue, but I suppose my 3rd point, and I have to say it's probably not the sexiest subject, but it's about data. It's about data and evidence and transparency. You know, the minister referenced, and we know that the current government are committed to having VOG in a decade. what's the baseline? Where's the numbers? What are we measuring? We know that our police forces in some areas of the UK are not actually disaggregating information by age, and the data's just not there. So we need, if it's not tracked, it's not fact. We need to understand the scale, the patterns, the outcomes, because all of that is actually a critical part of prevention and proper policy making.
Thank you. And that leads me nicely into a question actually now for Elizabeth, because we're hearing now about data collection, how the police forces actually interact with victims, recognise it as a crime. So from your perspective, from the front line, staff often recognise that there are patterns in behaviour before policymakers do. So from your perspective, what impact can frontline staff have in terms of influencing the policymakers and the legislators and driving forward this awareness that we all want to be at the forefront of everybody's minds?
Absolutely. I think the frontline team are vital to raising awareness and engaging with people out there, the professionals and people within the community, to highlight issues and to bring all of this to the forefront. We on the frontline do often see lots of challenges around various challenges around victim blaming or maybe improper use of terminology of the older person. So for example, we do receive referrals from various professionals, especially the police. We work with lots of police forces. And within those referrals, there is often challenging terminology or words used to kind of imply as a blanket rule that older people are all tarred with the same brush. And it's extremely difficult for us to raise awareness so that other people recognise and change these terminologies. But we have been able to, in the past, we've been able to positively make an impact and a change across services. And we've been able to support professionals and service users as well to raise awareness around spotting the signs of abuse and some of the challenges, and not also identifying themselves as potential individuals who are not worth receiving the support from our services, because of what's been seen across the media and in the social society, that older people are blanket ruled with a term of, frail or mentally infirmed. We had a report come into our service previously with the police force. We received DARAs, but they were previously DASHs, the domestic abuse, stalking, harassment. They're now the DARAs, which have been changed locally in one of our services. The police force sent in the DARA, and on the DARA, it was referred that the older person was mentally infirm, e.g. dementia. So we know that this phrase has been phased out since the late 50s, and of course part of the major acts in the 59, 83, and then in 2008, the Mental Health Act. The use of this term really does imply that the older person is not only living with a condition such as dementia, but is too frail to even cope on their day-to-day lives. So it's completely outdated and archaic, and we work to, as I say, raise awareness around that, highlight those potential risks that it poses to an older person by using this terminology. We try and promote a trauma-informed approach as well to support that service to recognise what they're doing. Positively, the outcome of that incident was that the discussion with the police force meant that they actually changed the terminology that was used on their DARAs going forward. So mentally infirm was completely removed, and that was changed, and going forwards, the individuals are now no longer identified as living with dementia, because we know that somebody who is experiencing trauma may show signs of confusion and disassociation, and those are the things that we don't see replicated in services that support younger individuals. We don't see them being tarred with having dementia or living with a condition such as this. But as soon as you get to a certain age, then for some reason it's considered as it's dementia, not a trauma response. So we find that challenging those and really making sure that the individual is seen as a unique person, and that the challenges that they face are not because of the personal professional bias of the onlookers and people that are taking the reports. And we want to make sure that individuals have checks, and they're double checks, and it's scrutinised, and that people are supported going forward, so that these changes are positive throughout the services. So yes, as I say, we do come across quite a lot. That's the one that comes to mind mostly, because it's the one that we see most regularly, is individuals being tarred as living with dementia. There's lots of other challenges as well. Of course, on the broader patterns, we see casework patterns around professional personal relationships. We feed back internally to our teams and raise the findings with our policymakers. We go to meetings and do roundtables and all sorts of lobbying. So through our wider research, we can expand into other areas and show that our data that shows trends and demonstrate our expertise to show the commissioners as well for the need for our service. At the front line, as I mentioned at the beginning, they are the face and be all and do all of the policy and the work that we do here at Hourglass.
So building on that then, if you had your wish list that you could wave in front of the policymakers and the decision makers, what kind of investment or reform would make the biggest difference to you as frontline workers, and then obviously to the people that you're supporting as the older people themselves?
Absolutely. I think reform needs to start with recognition. As I've mentioned earlier, the support and awareness raising. Older people experiencing abuse are often invisible, and in domestic abuse and policy funding streams, if the reform was placed their needs at the centre, that we could get access to specialist advocacy, cross-centre collaboration between adult protection and health, and we could have a sustained investment and early intervention as well, which would be wonderful. We want to work in that preventative measure, not in that crisis situation, which we're often seeing our service users come into receive support for. I think that sustainable multi-year funding would be the biggest transformative change across the sector. So short-term or project-based grants, they really do force us into operate in a kind of hand-to-mouth like situation. So that limits our innovative sustainability, and we are committed to the core and the purpose of our service users and to be able to support them. So not only the services that we deliver, but the people delivering them as well. We need to ensure that we've got those frontline workers that do that emotionally intense casework. We need to ensure that we've got funding for structural clinical supervision, managing those caseloads. We know it's extremely demanding, and we often are the first people to see an older person after years of silence or disbelief. So burnout is extremely difficult for us, and having that structural support in place for that clinical supervision and empathy and expertise that we can share and support other individuals, it's the quality that we need across the service. So that reform, that's input, that multi-year funding, sustainability and investment would really ensure that the services truly be able to support and understand older victims and deal with those incredibly complex cases.
I think that's an incredibly important message to convey, isn't it? So I'm now going to turn to Colin and put you on the spot. So the Adult Support and Protection Scotland Act was groundbreaking, but implementation has not necessarily achieved everything that it's set out to do. So what's your experience of how it's actually working in practice for older victim survivors? And what could be done to actually ensure that the Act was fulfilling its potential and become more consistent and person-centred in how it's being implemented? Colin.
You're muted.
Don't you love technology, everybody?
Whilst Colin is trying to work out how to unmute himself, it's worth saying that Colin does a fantastic job as Scotland and Northern Ireland frontline service lead, and our conference was due to be in Scotland. So if you are watching us today from Scotland, please don't think that the fact that we went virtual was any sign of a lack of commitment to Scotland. We are 100% committed, and we will be doing an event in Scotland in spring next year. Colin, have you been able to work out how to unmute yourself, which is on the bottom left?
I'm wondering if Colin's been muted.
Yes,
Set up. There he
sorry.
is.
There we go. Welcome.
Well,
Sorry, I was on the wrong page there. So yeah, so the question regarding the Adult Support and Protection Act. So I would say that the Act itself, the principles and powers contained in the Act, I think are still sound. I think there's always been a lot of good good stuff contained within the Act. It obviously was quite forward looking at the time, back in 2007. I think obviously there's, like anything, any policy or any procedure or process is only as good as the people using it. So there's always going to be variation in interpretation and practice across the 32 local authorities in Scotland, and even within those local authorities, there will be variation. I think, like all adult safeguarding policy, there's obviously criteria for who is eligible for support under it. So the 3-point criteria. But even there's a lot of scope for interpretation within that. So what might look to one sort of council officer to be a case that is clear cut, and everybody it would be a clear case that can fit under adult support and protection, might not look exactly that way to somebody else, because they might approach it slightly differently in terms of their interpretation of the adult at risk. But on top of that, I've also observed a level of thresholding, and that not just in Scotland, but actually across adult safeguarding, that there's when resources are limited, practitioners have to triage, and at times it's only the kind of the most serious cases that are actually taken on, and that's not a criticism of practitioners, by the way. It is a systemic issue that we don't always have the resources or support that frontline workers need, but it does mean that some referrals might not get through that perhaps could if there was more resource. I mean, I'm aware that social workers are under huge stress, sometimes carrying, perhaps 50 cases on their individual caseload. But the stress, the huge stress that social workers are under can lead to enforced absences, which of course means that there's kind of less people to carry the load. I think also, while there are some really useful tools in the locker of the Adult Support and Protection Act, banning orders, powers of entry among them, as far as I'm aware, these are not used as often as they could be. Although perhaps having the option is enough, having that sort of in the back pocket. So for instance, a social worker could get a court order to enter the adult's property as part of their investigations, and knowing that might make the adult, or even an alleged perpetrator who's kind of gatekeeping that adult, it might make them more willing to allow the social worker access to carry out their work. I know that the lack of such powers in the Care Act, for instance, can and does hinder safeguarding inquiries. One of the features of the Act as well is the learning review process, which used to be called the serious or significant case review. And I think these can be really useful, because similar to domestic abuse related death reviews in England, they bring the agencies that had been involved in a case together to look at what they might have done differently, to look at were there any gaps, were there any sort of missed opportunities. Now, the downsides to this process, though, for me, are that there's always a danger of these things being a discussion that changes nothing. What are the actual actions? What's going to happen as a result of this? Although I do know that adult protection leads do seek to implement the learning. Also, another downside to it is that these only happen after the event, and the event is the death of the adult, at which point it's really too late to put things right for that person. So I think maybe more of a sort of a real-time review to make sure that everything that can be done is being done during the adult protection process. That might be a necessary improvement.
Thank you, Colin. That's a really helpful overview of your site. I think we have a similar situation in Wales with our legislation where we have powers of entry, but it's still very difficult for professionals to actually step up and step into that, what appears to be such an aggressive approach to safeguarding, whereas they have no reluctance over it when it comes to children. I'm going to pick on Richard and Veronica again now, and I think building on what Colin said is how can we be making sure that we are utilising the legislation that we've got and the tools that we have to be really driving forward this safeguarding agenda for individuals?
Well,
Veronica.
I might just come in there, Andrea, and say, you know, and I completely agree, and not to take away anything that Colin said, completely agree with his assessment. However, I would say in Scotland in particular, we do have an issue with domestic abuse legislation, because in Scotland still, the definition of domestic abuse only applies to current or former intimate partners, and that lies outside the rest of the definitions across the UK and further afield. And I think that, you know, Hourglass really has a big job of work to do, and that will be one of the things we'll be campaigning very heavily on in Scotland in coming months and years. And I think next year's election in Scotland, I think that gives us a really good opportunity to start that dialogue. We need to see that definition change, because we know that 80% of the people who use Hourglass services every year are being abused by a family member. And yes, that includes current or former intimate partners, but you're talking around in the region of 50% are adult sons and daughters, and then grandchildren. So that's a key ip for me. Sorry, Richard, I jumped in ahead of you. Please
You
continue.
didn't at all, because I always think that whenever we talk about what needs to change, we always have to look about who are the instruments for change. Now, Veronica often uses the phrase, we are screaming into an abyss, which I quite like. And there's a lot of truth in that, because it sometimes feels as if we're knocking at hundreds of doors before we get any answer. But if you look at the UK as a whole, we have very few champions. The industry, the sector, older people, especially older victims of abuse or neglect, have very few champions. There is the Older Persons Commissioner in Wales and Northern Ireland. Both are relatively new in post, and we've met both, and they are very committed to the agenda. There is no such position in Scotland, which I know there are organisations fighting really hard to get that post in Scotland. An Older Persons Commissioner is very much needed. That said, the notion of what a commissioner does and the power they have needs to be reviewed, but we need that post. There is no minister for older people in Scotland, and there is no minister or commissioner in England. The domestic abuse commissioner, who's doing a keynote later on at this conference, makes very rare comments about the abuse of older people, which means that we lack a full-time champion there. As much as I know she does a fantastic job around domestic abuse generally, we lack a champion there. So we need these voices to be louder. We need more people in positions of power to talk about older victims and older victims around safeguarding. And until we get that, it's still going to be lots more screaming into the abyss.
Thank you, Richard. I think at this point, as we're starting to run short of time for the session, maybe we could move on and take some questions. So if I hand over to Joseph now.
Yes, me again, just going to go through some questions from the audience. We don't have a huge amount of time, so I'm really sorry for eating into everyone's break time a bit because of the early delay. Just very quickly from the chat, thanks Chloe Ferguson. She says, just wanted to say it's brilliant to hear some Northern Ireland representation on this panel and through the conversation so far, a region that so often gets missed, and we really appreciate Hourglass makes sure that it doesn't. Thank you for that. We're of course strong in all 4 nations, especially Northern Ireland. And now I'll just go to questions. Okay, can you talk more about what sort of specialist measures are needed to help support older people in order to achieve a safer aging society by 2050?
Who's going to pick up that simple question to answer?
That sounds like one to Veronica.
I was actually going to start with our frontline services experts, really, because they're working on this on a day and daily basis.
Sure, absolutely. We can pick that up. Thank you. So I think accessibility would definitely be one of the key things for our older victims. We talk a lot about hard to reach communities, but we should be really thinking about why those communities are not represented in the generalised agencies. So it's not that they're hard to reach, it's that the agencies aren't actually being able to support them. So what can we do to make those changes and bring those communities in on board? It's far better to consider why the services are then hard to reach and what changes can be made internally. We think about what the service needs are, and the accessibility across the sector. So for example, we see in court, when we're out and attending court, specialist measures have been declined for older individuals, putting them at risk and making them more vulnerable and susceptible for re-traumatizing and things like that. So specialist measures actually out in the community with different services and with the system that we support the older individual throughout that process. Lots of changes need to be made there. Giving evidence as well, and the use of technology, accessibility around supporting older individuals to even access their finances and things like that. So, you know, a change in our society is meaning that our individuals are being put at detriment and not getting the support that they need. So the specialist measures need to be considerate of how we can adjust those legislative frameworks as well to best support all of those individuals with additional needs. Colin, if you had anything to add. Thank you.
Yeah, so I mean, I think in terms of, you know, things that are needed, I think, you know, improved resourcing and regulation is crucial, particularly looking at how frontline work is resourced and regulated, and not just looking at the work that we are doing at Hourglass. I mean, ideally by 2050 we won't need an Hourglass organization. I know that might seem a bit of a, you know, kind of like turkeys voting for Christmas, but hopefully, you know, a safer aging society will exist, and there won't be a need for a service like us to kind of, you know, kind of pick up the, I guess, the slack. I mean, perhaps there will still be some slack in the system by then, who knows, but there are many passionate people working on the front line, but as I've already mentioned, I think they don't always have the time and support that they need to do the work. So to go back again to the Adult Support and Protection Scotland Act, the name includes support, but so often they, you know, workers will only have the time to focus on the protection part of that, when something has already happened. So when, you know, when abuse has already happened, that's when the intervention is. With better resources, including increased collaboration among partner agencies, which is already baked into the Adult Protection Act and to many other policies and processes, you know, but with increased collaboration and better resourcing, we can get the support piece right, and so hopefully prevent abuse from happening in the first place. For instance, if we saw more social prescribers or community link workers who usually will work in and out of GP surgeries, if we saw more resourcing for that sort of role, or something similar, older people at risk might be able to access support to improve their safety within their community, for example, you know, getting out and mixing with groups, engaging with other people more, so that they are less reliant on and less exposed to a potential perpetrator. alongside resourcing, as I said, I think improved regulation might help as well. And I think that's not so much about control of the workforce, but supporting the workforce. So if we are able to provide the right level of training and support, and also the right level of kind of quality assurance to make sure that, you know, poor practice is spotted and is dealt with soon, sooner rather than later, I think that will make a big difference. For instance, at present, there's no single registration or regulatory body for the social care workforce in England. If there was, there's less likely to be, I think, there is likely, sorry, to be, I think, increased knowledge and awareness of potential risk or abuse. So, you know, a social care worker entering an older person's home might be able to pick up more readily on cues and on signs and indicators. And they might also be able to offer more support in terms of if this person is at risk, what do we do about that? Where do they go with that? You know, and as I say, there's a lot of very passionate and very capable people already at work in that sector and in others. But it's how we kind of try and raise the level across the board so that everybody is kind of on the same page. And I think, you know, awareness at every level is not going to hurt. You know, I think raising the conversation and raising the issue in the public discourse. The idea that in Scotland we've had this kind of motto of seen something, say something. So if everybody steps up and takes that responsibility for, you know, I've seen something I'm not happy about, you know, I think, you know, my aunt, my neighbour, my whoever, my friend, I'm not sure that that's okay, and I want to just talk to somebody about that. You know, it's and also ageism and sort of microaggressions. That is how abuse starts. Abuse doesn't start, the pyramid of violence doesn't start with acts of abuse. It starts with attitudes. And if we permit those attitudes, then eventually we promote those attitudes, as to paraphrase one of my colleagues.
Thank you.
Okay, those are really good answers. And everyone's so passionate that we end up running out of time with one or two questions. I've got probably time for one more. Let's put this up. This is from Sarah Wade Vuletic. Sorry for my pronunciation if I got that wrong. Domestic abuse and sexual violence support services gather a great deal of data in their contact with older victim survivors who may never come into contact with police or criminal justice system. How could this data be safely utilised to raise awareness and create an evidence base?
Who's going to pick that one up?
Well, I can certainly
Rob?
start. And I think that point is really well made, because I know, for example, Hourglass are sitting on huge, vast amounts of data that would support what the premise of the question. Yes, we're sitting here, and what we are actually trying to do at the moment is trying to create a bit of a heat map so that we have county by county information across the UK on what is happening. A couple of years ago, we did look at this whole issue, and we did create the Safer Ageing Index. Now, I'm not saying this just because I'm in and from Northern Ireland, but the Northern Ireland Safer Ageing Index is actually the strongest of the documents we were able to produce, simply because there was more data available. The Police Service of Northern Ireland do disaggregate their data by age group, and they do publish it routinely. So we had a lot of information we were able to draw on from police statistics, but also in terms of poverty and life expectancy and health and lots of other issues. It's really surprised us that we weren't actually able to create a Safer Ageing Index for Scotland at all. We have one for Wales, we have one for different regions of England, and then we have one for all of England. We couldn't produce it in Scotland because the data wasn't available to us. Now, if we were able to find a way across the sector to share our research, to share our information, that then is actually, that's making me really excited. I think then that strengthens the case for support for all of us, because we're all in this together. This is what we keep saying. Wouldn't that be an amazing step forward? Not for today, but in coming weeks, we will be announcing a new initiative where we will be seeking like-minded organisations to collaborate with us, and formalise this campaign for a safer ageing society. So that is maybe one to keep an eye on and keep in touch with us about, and be part of this new initiative.
I think that's a really interesting note to end on before we send people off for their break. I mean, I've been asked to summarise this session, but I think we've covered such a broad area. The key takeaways for me, I think, it's all of our responsibilities to ensure that we're moving towards a safer ageing society. Hourglass can lead and champion us on our way, but we have a collective responsibility to individuals within our communities and within our families to ensure that they are safeguarded. And frontline staff are where the action is going to be happening, because those are the people on the ground, those are the people who are hearing the stories from older people, who are supporting older people as victims, survivors of abuse. And that's where it sounds like a lot of the richness of the data will be, because again, we know in terms of abuse cases across the piece, the Pareto principle applies. We'll probably only ever see 20% of victims. There's another 80% of people out there who never even make it to reporting or interacting with an agency. And we need to find a way to redress that real lack of knowledge that we have around what's actually going on in communities, and working in partnership with other organisations that are in the same area as us or in parallel areas to us is a real opportunity to be gathering that wealth of information about what's actually going on in communities and importantly in people's homes. So on that note, I'm going to bid you a fond farewell. Thank you very much to all of our panellists. I think it's been a really wide-ranging and fascinating debate, and I hope the rest of the audience have found it the same. So thank you.